Hey everyone, welcome back. So, the Senate just pushed forward one of the biggest, most controversial bills we've seen in years. Trump's big, beautiful bill. And while the name might sound light, the reality is anything but. This is a 940-page plan that touches nearly everything. Your taxes, your healthcare, your retirement, immigration, defense, even student loans. And guess what? It just barely passed the first step with a 51-49 vote, and the entire country could feel the effects. And here's something a lot of folks don't know yet. The Congressional Budget Office estimates this bill could add $3.3 trillion to the national debt over the next 10 years. That's a massive number. And it could also mean nearly 12 million more Americans without health insurance, mostly due to the deep cuts to Medicaid. So while the bill promises things like lower taxes and more money in your pocket, there's a lot happening behind the scenes that we need to talk about. Stick around because we're going to break this all down with just the facts, how they might affect you, and what to watch next. Before we jump in, I want to hear from you. If you had to choose, would you rather have lower taxes or better access to healthcare? Let me know in the comments. Your thoughts help this conversation, and if you find this helpful, hit that subscribe button. I do my best to keep you informed without the noise. Alright, let's start with taxes because that's the headline for most people. Trump's bill wants to permanently extend the tax cuts from his 2017 plan. That means if you like those tax breaks, they're not going anywhere anytime soon. There's also something new here, no federal tax on tips or overtime pay. That's right. If you're a service worker or putting in long hours, that extra income could be completely tax-free. And this isn't a short-term deal like we've seen before. It's written to be permanent. That's a win for a lot of people still working hourly jobs, including seniors who've gone back to work. But those tax cuts come with a cost, and that's where things get more complicated. Because to help cover the cost of all this, the bill makes huge cuts to Medicaid, $930 billion over the next decade. Medicaid isn't just for low-income families. It's also the backbone of healthcare for seniors and nursing homes, people with disabilities, and folks in rural areas who rely on local hospitals. Under the new plan, states would receive cap block grants instead of open-ended federal support. That might sound like flexibility, but what it really means is when the money runs out, it's gone. And if costs rise, states have to figure out on their own. The bill also lowers the amount of taxes states can collect from medical providers, which many states use to fund their Medicaid programs. So we're looking at a double hit. Less federal money and fewer ways to raise state money. Now, here's something a lot of people missed. There's a new work requirement for Medicaid. Adults under 65 would need to show they work 80 hours a month unless they're disabled or caring for a child under 14. And that's not just a suggestion. It would become federal law. So what does this mean if you're older but not yet 65 and facing health issues or job instability? It could mean losing your healthcare if you can't meet the rules. So, to soften the blow, the Senate increased rural hospital relief funding from $15 billion to $25 billion. That's meant to help hospitals in remote areas stay open under the new system. But critics say it's not nearly enough to make up for the broader cuts. Even Republicans are split. Senator Josh Hawley, usually a reliable party vote, called the Medicaid cuts a mistake and warned that you can't be a working-class party while taking healthcare away from working people. Now, let's talk about what this means for seniors, because there's one piece of this bill that was designed just for you. It's a $6,000 bonus deduction for taxpayers 65 and older, available through 2028. That's a nice boost on top of the standard deduction. But here's the catch, it phases out fast. If you make more than $75,000 as a single filer or $150,000 as a couple, you start losing that benefit. So this is really targeted at fixed income seniors, not retirees with bigger pensions or retirement accounts. And while any tax break is helpful, critics say it feels small compared to the broader cuts to long-term care funding and Medicaid. And here's something that flew under the radar. The bill blocks a Biden-era rule that would have added more staff in nursing homes, a plan expected to cost $23 billion. Without that rule, some facilities could face understaffing and closures, especially in low-income or rural communities. Now, switching gears for a moment. Defense and immigration spending in this bill is huge. We're talking $350 billion total, with $27 billion set aside for mass deportation efforts and $45 billion for new detention facilities. That's a massive shift in priorities, especially when compared to how much is being taken from healthcare and other domestic programs. So how did the Senate get this through? Barely. It took last-minute deals between leadership, Vice President J.D. Vance, and several conservative holdouts. Some senators only voted yes after getting changes to cap Medicaid expansion and lower federal matching fund for states. And yes, there was deal-making. Senator Lisa Mowsky got a tax break for Alaskan whalers. Senator Tom Tillis got slammed by Trump on Truth Social for voting no, and then he announced he wouldn't run for re-election. So this wasn't just business as usual. Democrats, furious about the contents of the bill, used a rare procedural move to force the entire 900-plus pages to be read aloud line by line. That stalled Senate business for nearly 15 hours. And after that, we're now in what's called a vote-a-rama. It's a long open-ended process where senators can propose endless amendments. Some are meant to pass, but others are designed to force political choices. It's kind of like a high-stakes game of chess with the American public watching. Let's talk about education for a second. One major change in this bill is new caps on graduate school borrowing. If you want to become a doctor, lawyer, or teacher, you won't be able to take out as much in federal loans. That means more students might turn to private loans with higher interest rates and fewer protections. The idea is to push people toward cheaper schools or shorter programs, but the reality is it could shrink opportunity for lower-income students and limit who can afford to pursue high-paying careers that require advanced degrees. Meanwhile, for babies born from 25 to 29, there's a new $1,000 Trump baby account. It's a government-seeded investment fund meant to help families build long-term wealth from birth. It's an interesting contrast to the Medicaid cuts, giving money up front, but scaling back support later in life. And let's not forget the Court Enforcement Rule Section 70302. This part of the bill says that if someone violates a court order like a restraining order or tenant protection, the court can't punish them unless a financial bond was posted at the start of the case. And this rule is retroactive, so if your parent is in senior housing and a court order was supposed to protect them from a neglectful landlord, but no bond was posted, the court might not be able to enforce anything. That's a big change in how the legal system protects vulnerable people. Also worth noting, some things didn't make it into the bill. The Senate parliamentarian ruled that certain carve-outs for Alaska and Hawaii, as well as some exemptions for orphan drugs and Medicare, violated the Byrd Rule and had to be removed. Other controversial policies, like banning Planned Parenthood for Medicaid funding, are still under review. So where do we go from here? Well, even if the Senate passes this, it goes back to the House. And already members there are sounding the alarm, especially on Medicaid and food assistance. Some are saying the Senate bill strayed too far from the original House version. Elon Musk even weighed in, calling the bill utterly insane and a job killer, warning that it could backfire on Republicans in a big way. So here we are at a crossroads. This bill is about more than just numbers on a page. It's about how we as a country decide to balance growth with care, tax relief with coverage, and personal freedom with social support. Seniors might get a small deduction, workers might pay no taxes on tips, but in exchange, millions could lose access to the healthcare and programs they rely on. So then let me ask you, do you think this bill strikes the right balance, or is it pushing too far in one direction? Drop your thoughts in the comments. I read them all. And if you want more updates like this, subscribe and stick with me. I'll keep breaking things down without the hype so you can understand how policy really affects your life. Take care, and I'll see you next time.